Hello, my name is Dr. Chrissy Gale, and earlier this year I was working with a working group comprised of international child protection and child rights organisations, hosted by International Social Service and UNHCR, and together we worked on a massive open online course that helped practitioners around the world who wanted more information about how to adapt child protection case management during the COVID-19 pandemic. The massive open online course looked at all aspects of child protection case management, from being able to identify children of concern, refer them to child protection agencies, wherever possible still undertake a multi-sectorial child protection assessment, and respond with all the services and support a child needs. We've now run the massive open online course for 80 days, and we've had thousands of course participants from over 160 countries in the world. And something that became very apparent from all the comments and ideas that course participants were sharing was the heightened risks and concerns that we have for children because of issues such as lockdown and social distancing due to the COVID-19 pandemic response, and not actually being able to get to children who we would normally be able to work to face. And in addition to that, the concern that there may be many, many more children facing serious child protection risks whom we're not aware of. We do hear a lot about increased domestic violence, and we know that has an impact on violence against children. We're also hearing from the comments from MOOC course participants, as well as reports and evidence that's being issued by major international and national organisations, is that there is heightened risk for children who are now locked away in detention centres or perhaps in residential care centres, that borders are being closed for unaccompanied and separated children on the move, and street children can no longer access the normal services they so badly need. There are reports of increased child labour because parents can no longer get out to work themselves, and that causes additional vulnerability of children being very, very at risk of such issues as trafficking and sexual exploitation. So we wanted to think very carefully about not just being able to reach and find these children right now, but also what we're doing in advance of the end of the pandemic so that we can plan and then very carefully reach out to children and provide them with the support and care and protection they all need. We've invited 3 international experts to speak to us through a video link, giving us their advice and their recommendations on how we should be preparing for the end of the pandemic, and just in case we see many, many, many more children that we don't know about, how are we going to respond effectively? Anne Skelton is a member of the United Nations Committee on the Rights of the Child, and we've asked her to speak from a global perspective. Matilda Luna is a director of RELAF, which is an organisation working across South America with governments and non-governmental organisations, particularly on the concerns on the protection and support for children who are losing parental care or who are already in alternative care. And Sophie Etzod is the Child Protection Officer for UNHCR in Uganda, and we've asked her to speak from a national perspective. So I'd like to turn to you first, Anne, and ask you, based on all these additional child protection concerns we're hearing about, and the fact that very often we're not able to reach the children we normally can see face to face, what is the UN Committee on the Rights of the Child helping states to prepare for and respond to these concerns in the aftermath of the pandemic?
Quite early on in the pandemic, the committee issued a statement setting out its concerns about the COVID-19 pandemic and the associated lockdowns that states were putting in place at the time, and the impact that this would have on child protection. In particular, the committee flagged education because we knew that during these lockdowns, most children were not accessing education, except for those who were living in households where technology was available to them that would allow them to work from home and they had the adequate supervision. But we knew that this was not going to be the case for the majority of children, and particularly not children living in vulnerable situations, and, for example, migrant children being amongst those. So a second issue that we were concerned about was nutrition. And interestingly enough, this is actually linked to education because we know that so many children receive their an important part of their nutrition, at least, from the school nutrition programs in various countries around the world. So not only were children losing out because they were not getting their daily meal at school, but in addition to that, because of the financial hardship that families were enduring due to the lockdowns and the financial circumstances pertaining to that, children were actually going to bed hungry. And this was something that the committee was very concerned about and called on state parties to work on and to ensure that relief was reaching all children in all situations. Healthcare was another one. We were concerned about the fact that children's right to access vaccinations was being interrupted because many clinics had closed and were not operating, and all the resources were going into COVID-related activities. And in the same vein, many ordinary health services for children were not operating as usual. In addition, we were very concerned about the mental health of children. And of course, we were very worried about any children who were in any form of detention, not only because of their health risks and including their mental health risks, but also because they might be cut off from their families and that there could be delays caused by the lockdown measures that were being taken. We were also very concerned about birth registration because the usual birth registration measures were often halted in countries during the pandemic, and in some countries this still has never really, many months later, got back to normal. And this would affect both nationals and children who need birth certificates to be able to show that they were born in a particular country, even if that birth certificate doesn't immediately give them nationality of that country, but having a record of your birth is so very important. Violence against children was also a big issue that the committee flagged because we knew that with children being in confined spaces, including in their own homes, where they normally would be going out to school or going out to play, but now they were having to be with adults in a confined space and other children for long periods of time, that this would be very difficult to manage, particularly in families that were very constrained, in accommodation that is overcrowded, in any situations where children would be now confined for long periods of time. This would obviously affect their right to play, their right to leisure, and it would also affect the relationships between them and their parents and caregivers, and the likelihood of violence being increased in those contexts, we thought was very high. So we were concerned, and we also asked states to try to take what measures they could to alleviate this kind of situation. Now we are in some countries coming out of lockdown, some are going into a second wave, but I think that we can see already that the impact of COVID-19 has caused a significant protection gap, and the committee is already working on what it is going to do to try to close that gap. So we have already begun to ask questions in our list of issues prior to reporting that we've been sending out. The committee has been meeting online, not able to carry out all of its mandate, but at least we have continued with the work. And the questions that we are now asking states are both backward-looking, and forward-looking. So the backward-looking questions have to do with what happened during COVID-19 in your country in relation to child protection. What measures did you take? What did you learn from the experience, and how would you do things differently again? So that takes us into the future-looking scenarios. And in the future-looking questions, we're also asking the bigger questions about how are we going to ensure that children's rights and the gains that we have begun to make are not set back in a retrogressive manner because of the impact of COVID-19. So around budgeting, planning, programming, we're going to be asking states what measures they are taking to make sure that austerity budgeting doesn't completely erode the gains that we have made. We'll be having an eye on the SDGs to say, well, states were aiming for this. Has the COVID impact changed that? And what are states doing to mitigate any setbacks that have been experienced? So I think, as we can see, the impact of COVID-19 on child protection is profound, but it's important that every state in its plans going forward ensures that the least possible disruption and the least possible retrogression of rights can be achieved.
Thank you very much, Anne. Matilda, we'd now like to turn to you and ask you, what are the principal protection concerns for children in alternative care that have been identified during the COVID-19 pandemic across Latin America? And what recommendations do you have regarding how governments within a region can work together to prepare and respond to these concerns once the COVID-19 pandemic is over?
Las principales preocupaciones que hemos tenido durante el largo periodo de pandemia han sido muy diversas. Si bien podemos reconocer una presencia permanente de la incertidumbre, del desconocimiento, de la inseguridad respecto del porvenir, también podemos decir que hemos pasado diferentes momentos, que han habido como diferentes etapas. Probablemente eso tenga que ver con los acontecimientos y con la adaptación que fuimos haciendo, tanto las familias como quienes trabajamos en los servicios de protección infantil. Esa adaptación, en muchos casos, podríamos decir en América Latina, la región más desigual del mundo, han sido cambios de tipo adaptativo. Una adaptación que tuvo que ver más con la sobrevivencia, con la posibilidad de seguir adelante y aguantar hasta que la pandemia termine. Los servicios de protección, sobre todo los de cuidado alternativo en América Latina, están muy basados en el cuidado residencial. La gran mayoría de los niños que están separados de su familia y están bajo algún servicio de protección en este continente están en residencias, en hogares de todo tipo, grandes, pequeños, pero residencias al fin. Entonces, al inicio de la pandemia fue una gran preocupación, porque nosotros sabíamos de las situaciones o los problemas preexistentes a la pandemia, que quedaron a la luz, quedaron recrudecidos por la problemática que trajo la pandemia. Por ejemplo, el tema del personal. Es decir, el personal que trabaja en esos lugares suele ser un personal a veces de baja calificación, a veces escaso, y se demostró durante la pandemia que también son personas que a veces tienen enfermedades preexistentes y son personas que ya están dentro de la edad de riesgo, por lo cual escaseó, disminuyó mucho el personal con el que contaban las residencias. Tuvieron que irse a casa esas personas. Eso que pasó, que los niños tuvieran menor cantidad de personas que los cuidaran. Y también lo que nosotros llamamos esa característica de encierro en la cual están los chicos que están dentro de las residencias, se vio reforzada, ¿no?, por el aislamiento social preventivo y obligatorio. Los chicos no pudieron salir, no pudieron ir a la escuela, aquellos que tenían salidas, salir a ver a sus familias, se quedaron adentro mucho tiempo, y eso trajo una consecuencia muy seria para la salud mental de los niños y de las niñas. Eso es un punto que obviamente requiere de una mirada post-pandemia reparatoria. ¿Cómo están esos chicos hoy en día? Entonces, por un lado eso, por otro lado también sabemos que muchos servicios se han paralizado, muchos hogares se han cerrado, lo que significó que los niños y las niñas salieran de esos lugares después de haber estado mucho tiempo viviendo en muchos casos adentro. ¿A dónde fueron? A las familias de las cuales habían salido. ¿Esto qué significa? Una vez más, corroboramos que los niños y niñas que están dentro de los hogares, en su mayoría, tienen familia o tienen algún vínculo afuera, como fueron en estos casos personas que recibieron a los niños. Entonces, también podemos decir que durante la pandemia y en RELAF, nosotros trabajamos en una gran cantidad de países de América Latina, pero hemos podido continuar desarrollando los programas de acogimiento familiar. En países como Argentina, como México, como Venezuela, se han podido no solamente dar continuidad, luego debo reconocer, de una fase inicial quizá de desconcierto, una vez que empezamos a trabajar y a generar las condiciones para poder trabajar de manera segura durante la pandemia, con el uso de los medios electrónicos y demás, se pudieron inclusive desarrollar nuevos programas, ¿no? Lo cual obviamente ha sido fantástico poder ver que en cualquier contexto, aún en contextos críticos como los que ofreció la pandemia, hemos podido desarrollar el cuidado alternativo en familia de acogida. La gran lección aprendida es esa. Debemos de todas maneras apostar en América Latina de una vez por todas al cuidado familiar. Debemos invertir más aún en estos tiempos post pandemia de recursos escasos, de recrudecimiento del empobrecimiento en la familia, ¿no? También de recursos escasos en el sentido de los servicios que han tenido disminuido sus recursos, tanto los públicos como los privados. Debemos apostar a la familia en todas sus formas, las familias de origen, las familias de acogida, las familias adoptivas. No debemos dejar, al contrario, debemos redoblar los esfuerzos para trabajar con las familias y con las comunidades.
Thank you very much, Matilda. Sophie, coming to you now, we know that there are heightened concerns for unaccompanied and separated refugee and migrant children, including the impact of heightened discrimination, locked borders, lack of access to essential services, and possibly being locked up in detention centres. Many countries are still in lockdown or have social distancing that may be preventing support reaching these children. In these situations, what should organisations be doing at a national level to effectively prepare and respond once lockdown and social distancing can be over?
I think the question you raised is very critical, and it's good actually to think about really what we should and can do now and also really in the upcoming time. So one thing I think is critical for our sector in the humanitarian refugee child protection response is really to ensure that we have the relevant capacity to perform this duty, to ensure that we respect do no harm policies, etc. So to build on capacity, to use that time to reflect on capacity building needs, to ensure that those needs really reflect what is required on the ground, what makes a difference for children when we're dealing with them. So be it on case management, procedures, that we're really ensuring that there's quality of work done, but also really to ensure that we address maybe specific child protection issues. So for example, the increase we are seeing here in our context of abandonment of children, of the increase of psychosocial needs or psychological distress displayed in children, and to really see, okay, what are the specific capacity needs that we need to build in this time and beyond to reflect or to better respond really on the needs of children. So I think the linkages between the child protection sector and MHPSS, or more concerning the PSS really in detail, are very relevant to look into and to create better linkages here to ensure that our staff is really well prepared. Linked to that as well, I would say, is a second point which relates to data management and information management. So we've seen that A large number of children do face separation from children. So in the Ugandan context, for example, we have a large number of unaccompanied or separated children registered with the Office of the Prime Minister. So we have beyond 40,000, which is a massive number to respond to with the limited resources we have here. But are we able actually to properly document the child protection risks they are facing? And then later on, when access is eased and really the COVID situation allows maybe for returning into a more face-to-face contact with children, that we're really ensuring that we are managing the data and that we're documenting actually the child protection issues. So I think really ensuring data and information management in the child protection sector is really critical as well. Those 2 points, I think, link very much as well to a third point that is very critical. And I think it's kind of the core to what I would say this whole COVID situation would bring us, is that we are able to really rethink child protection programming. So we've been doing a lot of child protection interventions in a way we've been doing it maybe for the past years, with case management, with community-based approaches, with awareness raising, that is a lot going on, and alternative care, etc. But I think it's a good time to reflect really on how to amend and kind of strengthen our internal, programming on child protection. So while the COVID situation has brought a lot of challenges on a psychosocial level for caseworkers, for children, adolescents, for the community overall, for parents and caregivers, I think it's also really giving us an opportunity to rethink how we want to do things and what are the responses we want to put in place and what are the approaches we are using here. So I wish that we take this time to really reflect on what has happened in the COVID context. So for us, we are seeing, for example, a dramatic increase actually in teenage pregnancies in the Uganda context. And so how do we use this information to build really programs that respond to that and are community-based or child-led, adolescent-led programming? So if I want to support teenagers that are pregnant, or young adolescent girls that are pregnant, how do I do that? First, I need to include them in this response and really build on their wishes and their needs that they articulate with us. And then one could think about programs that really ensure kind of a not the business as usual approach, but really looking into how to practically provide responses. So for example, if we want teenagers to return to school as they have faced challenges attending school due to their pregnancy, we need to ensure that we have support programs available, through the community, for example. So childcare support groups, for example, by women that are staying at home or by elderly. So older refugee women, for example, that actually maybe even would benefit from taking care of children, young children, where we often see a link in their increased psychological well-being as well. And so do we establish peer-to-peer support groups, for example, so that teenagers actually have a tool to vent and to reflect and to have a group where they maybe feel, they can share and really feel maybe free and supported. So these are, I think, very critical aspects. Or if we're looking at alternative care, maybe we want to establish a foster care support group. A lot of foster care mechanisms have been constrained. Foster families have dropped out of the program. They face socioeconomic challenges, but also other challenges in dealing with children with psychological distress, etc. And so maybe we tackle the issue by really revising our response, having foster care support groups or other innovative practices to really address the specific protection issues that we've been identifying throughout this COVID situation. So I think those are elements I think we should reflect on. So it's a time actually for us to reflect and rethink our programming. And on alternative care, I think, and that links up again with my first point on capacity building, on data management, but also really on innovative practices. I think when we're talking about unaccompanied or separated children, as this was the specific question here, our quality of implementation and the resources attached to it, I think, are quite constrained. So I would wish also to kind of use this as a reflection on our own resources and capacities and to link the protection needs identified really to a proper programming. So often alternative care is put kind of under the case management framework, and then the usual caseworker is following up on alternative care. However, what we see is really that what we need to do is to program for alternative care, be it support to the national system strengthening, be it support to caseworkers, create monitoring mechanisms, ensuring that children are really safe and there is no harm created by any alternative care program. So I think those would be reflections I would consider in this current situation, particularly focusing on unaccompanied or separated children, but also other protection risks.